Welcome back to Detroit Wants to Know. Spring has finally sprung around here, and a lot of you are thinking about getting back into that gym. You're thinking about taking your bike out for a ride. You're thinking about going rollerblading. Well, let me tell you, if you do that, do it with moderation. But also, if you mess yourself up, if you get hurt, the best place to go is the DMC Sports Medicine Rehabilitation Facility out here in Farmington Hills, Michigan. Dr. Lemos, the head of it, you can shake my hand. I'm not afraid of you. What goes on here? What happens to those people that have been sedentary all winter and now they're trying to get into the gym or they're trying to rollerblade, they're trying to carry a cooler? What happens? And what happens here? Because you do it at the larger level also for the people that are actually making big money to do this.
Absolutely, and whether you're a professional athlete or you're a weekend warrior, spring can be a tough time because you've not done a lot of stuff over the winter. You come back, and some people are better than others about keeping in shape during the winter months, and so when they come back, sometimes they start a little bit too hard. The best, as you said before, the best thing is moderation when starting back, starting a little bit at a time. And I always tell people, especially if they're coming back from an injury or something like that, start with 25% of what you think you can do, because you can always do more the next day. If you've done too much, then it's too late. You've already injured yourself.
Now, out here, you take care of the Pistons, the Tigers, and the Red Wings. Tell me about that. What's it like with these professional athletes whose bodies are worth millions of dollars? Their high performance is worth millions of dollars to the owners. What's it like treating them?
Well, I kind of describe it like this. Someone who breaks their leg, you're trying to get them from being unable to walk to being able to walk again. If you're taking a professional athlete, let's say a pitcher, and they lose a couple miles an hour on their fastball, you're trying to get a very high performance athlete to be that much better. So it's a challenge, but we embrace that challenge here because we want to, taking care of professional teams means you're at the top of your game. And for a sports medicine doctor, whether you're a non-operative sports medicine doctor such as Dr. Haque, or you are like myself, a surgeon, getting them back, getting a professional player back to the top of their game is the ultimate challenge.
So wait a minute. How could you actually make Papa Grande's throw faster? I mean, what would you do for that?
Well, first of all, I'm not taking credit for that, okay? But there are several ways. First of all, for a pitcher and for anyone, for any athlete, the rotator cuff for the shoulder is extremely important. And if, let's say, his rotator cuff was out of balance, in other words, some muscles were stronger than others, just working on that muscle balance can actually improve his ability to throw. And
because we need him as a super closer.
Absolutely, we need him. And he's gone out, done the right thing, lost weight, gotten stronger, and he's doing a great job this year.
Okay, what is the most, what kind of injuries do you see from hockey players? The Wings are once again in the playoff hunt. What do you see?
Again, not just focusing on shoulder, because as you know in hockey they have upper body injuries and lower body injuries, but shoulders are very common in hockey players, and specifically a joint called the AC joint. Okay, and in general, with shoulder, there is a dislocation, and that's where the ball and socket come out of place. And then there's where the collarbone or clavicle meets the acromion bone. There's something called a separation. And for instance, a famous one in 2006 was Placido Polanco, separated his shoulder. And that's a very common injury in hockey because of checking. Okay? And that is one that is usually treated with non-operative management, physical therapy, and things to decrease the pain, but that's a very common injury because of checking in hockey.
Okay, and finally basketball. We've seen several basketball players out right now. What do you do?
We have an epidemic of ACL injuries, and particularly in guards in the NBA. And there's several things that you can do. One of the most important things is to do something before it happens. And that's where our comprehensive program comes into play. And what we do is we have the performance centers that work on neuromuscular training. So working on a combination of coordination as well as strength of the muscles to help prevent ACL injuries. And that's where you start. And then after that, it's if you do have an ACL injury, it's actually, rehab is very important right afterwards to get your motion back and get the swelling down. And then it's to have surgery done by the right surgeon. And then obviously afterwards it's the rehab, getting back and doing that neuromuscular training, and then to keep the ACL and the knee healthy and happy, to do the exercises for life to keep it strong.
Okay, well, Dr. Lemos, I'm going to actually talk to Dr. Haque next. He's with non-operative.
Right.
And then later on, Alfredo Bowden's going to talk to the trainer here. So we're going to see the whole picture. Thanks for coming on. Ladies and gentlemen, when we come back, it's Dr. Haque, and we're going to talk about non-operational, non-surgical repair for you. So we'll be right back from the DMC Sports Medicine Center in Farmington. Be right back. Welcome back to Detroit Wants to Know. This week we're coming to you from the DMC Sports Medicine Clinic in Farmington, Michigan. My guest this segment is Dr. Haque, and he is non-surgical sports medicine.
That's correct.
Dr. Haque, what in
Yes.
the world is that?
Well, what that is that we essentially treat all orthopedic injuries, back problems, knee problems, shoulder problems. We do an initial evaluation to make sure that there's nothing surgical there. Typically, our treatment plan consists of physical therapy, possibly injections, and just to give it time to see what happens.
Now, there's several older people that have bad knees.
Correct.
There's some injection that you can get instead of getting a knee replaced?
Absolutely. Most folks who have knee arthritis are typically managed conservatively. What we mean by that is we try injections such as steroid injections. There's also what we call viscosupplementation, which is just a fancy word for gel injections. Mm-hmm. We try those things, weight loss, exercise, and we see what happens. And if
Did my crew tell you to say that? Weight loss? Okay. Anyway, go ahead.
And if the patient is able to successfully limit their pain that way, we can hold off a knee replacement. Sometimes patients require knee replacements because the pain is just too much to tolerate and it affects their daily life.
Okay. Shoulders, what do you do for shoulders when they hurt?
Similar. Shoulders are similar. We try physical therapy, injections, providing that there's no tear. Typically, we'll order some imaging to make sure that there isn't a rotator cuff tear. Sometimes those will not get better with non-surgical treatments and will require operative treatment.
Well, it's springtime. A lot of people are getting back into the gym. How can people avoid coming to see you?
The best way is to use proper form to exercise, but sometimes you're going to get those aches and pains, and typically folks just want reassurance just to make sure that there isn't anything more serious. And that's what we're here for, is to provide that.
But you say start off slow because you're coming off of winter, you've been sedentary, and now you want to get back to that beach look, or try and get to that beach look, and not beach whale look. But if you go too hard at it, then you're going to end up seeing you.
That's right, and it all depends on what your previous medical history is, and sometimes how old you are can make a difference. And typically, if you've been exercising and you're used to it, and if you want to ramp up, that's certainly possible. But if you have been sedentary and have been a beached whale, as you said, then you may want to take it a little bit easier.
Okay. How did you get how'd your education come about? Where are you from?
I am from the Detroit area. I grew up in Livonia, Michigan. I went to undergraduate at University of Michigan, Ann Arbor. Was disappointed when they lost in the NCAA final.
But you got it. You got that little guy was amazing.
Yes,
he was entertaining.
Talking about me or Trey Burke?
Trey Burke. No, the little guy with the red hair. What was his name?
Oh, Spike.
Spike.
That's right.
That was highly entertaining. That was highly entertaining.
And then I went to osteopathic medical school in Chicago, came back here for residency and medical training at Henry Ford and Genesis Regional Medical Center.
Okay. So what's your opinion of the DMC?
I love it. I love working here. We do a great job, and we're always available to folks who want to be seen for any joint problems. And the number is available on our website.
No, it's all over the place,
That's
dmc.org.
That's right.
Okay, Dr. Haque, I want to thank you very much for showing this, because there are a lot of people that are back in the gym now for the first time. They are throwing their backs out. They are throwing their shoulders out.
Yep.
And it's good to know they have a place they can come.
Absolutely. Yep.
All right.
Very good. Nice
Dr.
to see you.
Have
Thank
a great
you.
one.
Thanks.
Yep. We'll be right back, and Alfredo Bowden is going to take us into the personal training aspect of the DMC Sports Medicine Rehabilitation Center out here in Farmington Hills. We'll be right back.
Welcome back to Detroit Wants to Know. I'm Elfrida Bowden, and joining us this segment is Allison Cortellini. We're here at the DMC's Sports Medicine Clinic. And Allison, I have to ask you, what is it that you do here at the DMC?
Yeah, so I am a certified athletic trainer by clinical background,
Yes.
but my job here at the DMC is to provide a nice service for our patients when they call in to get a quick appointment with our physicians, get them in for physical therapy if they need that, or at our Sports Performance Academy. So I'm the Sports Medicine Outreach Manager. Anything in the community, I help with that extension of our facilities into the community.
Well, now it seems to be that cardiovascular health is just of big, high importance and emphasis. Can you tell us what kind of programs are designed and developed to keep our hearts healthy?
Yeah, absolutely. So we recommend a typical 30 minutes of cardiovascular, whatever that venue may be, elliptical, bike, treadmill, and then using that program 3 to 5 times a week for the general population, and then working out into the aging population, really trying to increase some resistance training, some type of bands or some type of functional training to really keep their bones more dense and more strong moving into their aging, time of their life.
Now, do athletes, or I should say, do patients tend to seek out you all services individually, or do they kind of go through their insurances? How is it that they kind of link what their needs are to the services that you provide?
Yeah, so we have a really great website, and on the website you can also reference our sports medicine program, and then my number is on there directly to be to get any appointments in with our docs, or x-rays or MRIs, any images you might need. I also help schedule too with our PT clinics and our Sports Performance Academy. So that's a great reference point, but I get all sorts of calls, we see all sorts of different things, so it could really be any type of goal that client's trying to achieve.
And so I guess I would still have to ask, what actually made you think that this is the realm that you wanted to go into? This is the career for me.
Yeah, so I really, really have a passion for fitness and health and helping people get back to their goals. And this sports medicine venue is a great way to help heal and help really get to the root of why people experience pain, and then allow them to get back into their function, whatever that might be.
And how much training does something like this take to
Yeah,
get to this point?
I have a 4-year undergrad degree from Albion College, and then 2-year master program that I went to at Cal U of PA. And then I just, through my experiences with DMC, I've kind of worked my way up within our sports medicine program in our academy, and now I'm a representative in the community to try to help promote and talk about our docs and all of our staff to the community. So it's a great position to be in.
Well, thank you so much for joining us today, Allison. I really appreciate all the great information that you provided.
Yes, thank you.
We will be right back with Get Up and Enjoy Detroit. I'm sure that there's a lot of things that we can discuss as we get out and enjoy what Detroit has to offer. Thank you.